Hello, this is Dr. Daulton from Hammond Chiropractic, and I wanted to make a video for you today just to talk about medications for back pain, and more specifically whether or not those medications are a good option for you if you're dealing with some kind of back pain that you're trying to treat. But before we get into that, I want to go over a little bit of background first. I think it's important that we understand how the spine works, what the anatomy looks like, and how spinal problems actually develop so that we know what we're treating, all right? So let's start by taking a closer look at your spine, and we're going to use this model here. This is just two individual vertebrae or spinal bones from your back, and remember that there's actually 24 of these that make up your entire spine. But we're just going to take a closer look here, and if you look between the two bones, there's a cushion which we call the disc, all right, and basically that just prevents these bones from rubbing together every time that we move, because that doesn't sound good, right? Of course not. You want to make sure that those discs are nice and healthy and that they're doing their job. And if we look a little closer here, where the two bones come together, they form an opening at the back here, and that's where the spinal nerves are exiting the spine. Now this is actually the most important part of the whole story so far, because those nerves are what controls everything inside of your body. And if you're curious about more detail on that, I actually have a video on my website. It's on the main page. Just go to drdaulton.com and you'll see the first video there explains this in great detail. But the nervous system is actually what controls and makes everything happen within us. And I like to give the analogy that it's kind of like the electrical system in your house, because all of the power that runs your body starts in the brain. That power is sent down through the spinal cord, which lives inside of your spine, and then it's sent out through these individual nerves to all the different body parts, and that power is what runs the body and forces everything to do what it's supposed to do, all right? Now in chiropractic, what we find is that most causes of back pain is actually something called a subluxation. And what that is sometimes these vertebrae can actually misalign. And do you see how if that bone misaligns, it's going to close down on that opening where the nerve is coming out of, it's going to put pressure on the nerve, and then what happens is that the nerve isn't able to function properly. So in other words, the power isn't getting out to the body like it's supposed to, all right? And then what we do as far as treatment is concerned is that we come in and we realign that vertebrae, which is opening up the opening around the nerve, taking all the pressure off the nerve, the power starts to flow like it's supposed to, and you get better, all right? So not only does it affect pain, but it also affects how your organs function and how your legs function, your arms. Everything functions better because the pressure comes off the nerves, all right? But how do these problems develop to begin with? And I like to draw this diagram that I'm about to draw for you for patients because I think it makes a little bit more sense. So let me grab my marker here, and here's what I'm going to do to start. So I'm going to draw a line up here, and this line represents what we call optimal health. So I've got my little smiley face, right? He's a happy camper. Everything is working right inside of his body. Nothing hurts, so we're good to go. This is typically where we all start when we're first born, okay? Now from my perspective, what that really means is that all of the vertebrae in your spine are lined up properly. There's no pressure on the nerves, preventing them from working the way that they're supposed to, and therefore every single organ and body part is functioning at its optimum, and that's why we call it optimal health, all right? Now what happens to us is that when we're younger, we actually have small injuries that occur that cause those vertebrae to start to misalign. So it slips and falls. It's, you know, if you had brothers and sisters fighting with your brothers and sisters, I remember those days, playing sports. All of these things can cause small injuries to our spines and cause those vertebrae to start to misalign out of their normal position and start to put some pressure on the nerves. But at this point you may be saying, well, why don't I feel it? Why don't we see, you know, more kids having back pain, for example, if that's the case? Well, the reason for that is because we all have a pain threshold, okay? And your body is actually very interesting in this regard because you have to understand just a real basic concept about the human body, and that is this. Your body isn't actually designed to be healthy, believe it or not. I know that sounds crazy, but it's the truth. It's also not designed to be sick. Your body is actually designed to just survive. That's the whole goal. And so there's a whole number of different mechanisms that are going on inside of you at every minute of the day that are designed to make sure that you survive as long as you possibly can. your pain threshold is one of those mechanisms, all right? And the reason for it is that your body is going to try to adapt to whatever is happening to you at any moment in time. So if I have an injury, my body is going to try to deal with it without me being aware of it as much as it possibly can. But if it gets to a point where it hits my pain threshold, which means that it's gotten so bad that your body can no longer handle it without any type of help, now your brain wakes up and it says, okay, now there's a symptom here, there's a problem, you need to deal with this, okay? So that's what the pain threshold is. Now, that's a good thing most of the time, correct? Like, we don't want to feel all the different problems that are developing in our body at any moment. However, it's also bad because what this causes is it causes a lot of people to wait too long to get treatment, and then it creates a much larger problem that's more difficult to deal with at that point, okay? Now, as we continue through our lives and we become young adults and adults, the types of things that cause our spines to have damage become different. So, for example, we start working, right? And some of us sit all day for our jobs, which is not healthy for the spine at all. Your spine is designed to move. And at the opposite end, some people have very physical jobs which are way too demanding on the spine, and that can also cause damage. So either extreme is not good. Maybe you still continue to play sports. Maybe you still continue to have activities that put stress on your spine. All of these things continue to cause those vertebrae to misalign and put more and more pressure on the nerves until finally something happens that it finally takes you over your pain threshold. Now, there are some cases, let's say, for example, you have a bad car accident where you're immediately taken into the pain threshold because the injury is so severe. But for most of us, our back problems actually develop all throughout the years because of small injuries that add up eventually over time. So now at this point, we're right down here, right? We're feeling the pain and we're thinking, oh no, what am I supposed to do now with this back pain or whatever pain that's related to my spine? Because remember, it's not just back pain. You know, you can have neck pain, pain between the shoulders. You can have pain that shoots from your neck down into the arms. It can shoot down into the legs. It can also affect how your organs function. So, for example, if a person has a problem in the lower back, let's say a herniated disc, for example, which happens to be one of my specialties, but that can actually cause people to develop problems with their bowel and with their bladder, or in men, the prostate. So all kinds of things can be affected because of pressure on the nerves within your spine. So what happens here? So most people at this point, they go to their medical doctor or their family physician. And typically the first thing that they're going to start you with is medications. And there's a few different types of medications that they're going to recommend in this case. So, for example, anti-inflammatories are very common. Pain relievers are very common. And then also they usually combine that with some muscle relaxers, and that's what we're going to talk about right now, okay? So let's start with the anti-inflammatories. What is it that an anti-inflammatory is actually doing? Well, it's eliminating inflammation, right? That's basically what the word tells you. But have you ever stopped to think, what is inflammation and why is it happening inside of me? Well, let's explain that. Inflammation is when your body is sending blood to an injured area because it's trying to bring oxygen and fresh nutrients to the damaged area so that it can heal properly. The problem with that, especially when we're dealing with the spine, though, is that there's not a lot of room for those nerves to live. So if I bring a bunch of blood to the area, it's going to swell up. That puts even more pressure on those nerves, and that becomes even more sensitive, and now we have worse pain, correct? So what an anti-inflammatory does is it eliminates that inflammatory process, reduces the swelling so that you feel better. Okay, but here's a question I have for you, because that sounds good on the surface, right? It sounds like, ooh, I'm going to feel good. And that's always a good thing. But here's the question. If the purpose of inflammation is to help you heal faster, do you really want to stop that process? Does that make sense to you? That doesn't really make sense in my head, all right? It's not logical. You want your body to try to fix the problem if it possibly can. We don't want to stop that from happening because it's just going to take you longer to get better at the end. That's pretty much the bottom line. So that's what anti-inflammatories do. Now, what about the other pain relievers that are typically given to patients? Well, what they do and how they work is that they take your pain threshold here and they basically move it down to there, okay? So look what's happened at this point. At this point, you feel good because you're no longer hitting your pain threshold at this point, but have you actually corrected or fixed the problem? Have you taken care of all of this damage that's been done? No, you haven't done anything for that. And this is the reason why when people start with pain medications, what happens is that eventually the dosage that you're on isn't going to work anymore. So then now they have to keep increasing the dosage. And that's for two reasons. Number one, you're going to continue injuring yourself because you keep thinking that you're okay, and you go about your business as if nothing is wrong, which isn't the case because you haven't corrected the underlying problem. But the other reason for this is that your body adapts. Your body is going to eventually get smart to what you're doing by putting the medications in your system, and it's going to keep changing the pain threshold. So you have to take more and more and more of that pain medication to get any benefit out of it. And that's actually why in America there's such a huge issue with opioid addiction right now, because people are getting addicted to these medications. So you have to be really careful with that, okay? Now how about muscle relaxers? What are they doing? Well, they're causing the muscles to relax, right? But let me ask you a question. Why are the muscles tight to begin with? What actually causes that? And here's the answer for you. See, a muscle doesn't just do that on its own. It doesn't just happen without anything causing it. What's actually happening there is that the nerves that are going to the muscles are now irritated because you have pressure on them, and that's what causes the muscle to spasm in reaction to the nerve problem. So if I get a muscle to relax, have I actually addressed the cause of the issue still? No, I have not at all. I haven't addressed the nerve issue, which is what's causing the whole problem to begin with. You see, you have to get to the source or the cause of the problem in order to get any type of long-term relief. These medications are going to give you temporary help at best. And I guarantee you that if you don't do anything about correcting this, when you stop those medications, because let me tell you, they're not going to let you be on those for forever. And when you have to stop, the pain's going to come right back. And in fact, sometimes it's going to come back even worse because the condition itself was actually deteriorating the whole time that you were covering it up, thinking that you were okay. Okay? So that's what we're dealing with. Now, what do we do as far as chiropractic is concerned? What is our approach in trying to help you with the back pain that you would have been taking the medications for? Well, our idea is let's address the cause of it. Let's correct the actual problem that's causing your pain. And if we do that, the pain goes away and you feel better. So what we do is we recommend something called an adjustment. And what an adjustment does is it basically just allows me to realign the vertebrae, take the pressure off the nerves, and that causes you to get better and to feel better, but also for the problem to actually heal. Unfortunately, we don't have a magic adjustment that just gets you perfect again. That doesn't happen because we have to backtrack through all the damage that's already been caused there from all of the old injuries that you've had. So we make a series of adjustments with our first goal just being to get you back over your pain threshold so that you're feeling better, all right? For most people, that takes anywhere from 2 weeks to a month, depending on how severe your condition is or if there's any complicating factors, such as arthritis that's already existing in your spine, which makes things a lot harder to heal. But our first goal is just to get you feeling better. Some people think that they're fine at that point because we've been taught that pain means that there's a problem, and if there's no pain, we're healthy, which, by the way, is not true at all. There's a lot of conditions in the body that develop long before you feel a single symptom that something is wrong. For example, heart attacks. A heart attack doesn't just happen. It takes years and years and years for those arteries to clog up to the point where it causes a heart attack. And yet most people don't have a single symptom that warns them that something is wrong with their heart. Same thing with cancer. Cancer develops for a very long time before you actually have a symptom or feel that something is wrong. That's why a lot of cancers aren't caught until it's already in the later stages. So you have to be really careful about how you understand your health. Just because you're not in pain doesn't mean that there isn't a problem. But like I said, some people still believe that, and so they stop at that point. But guess what happens if you do? If you do that, all of a sudden it's not going to take much of anything before you're right back in your pain threshold and nothing lasts for you at that point. The pain comes right back again. So you may as well have just taken the medications because you just did the same thing if you stop at that point. What we then recommend is that you continue with a series of adjustments just long enough for us to get this as strong and as stable as we possibly can. And that requires a treatment plan or a series of visits. Now at this point you're probably thinking, oh man, so you mean I have to do a treatment plan, I have to come in 3 times a week, whatever the case may be, because we all hear that about chiropractic, right? People say once you go to the chiropractor, you always have to go to the chiropractor, etc., etc. And they don't understand, why can't you just fix it with one visit? Why do you have to have a series of visits? Well, let's put this into perspective for a second. If you go to the medical doctor and you get your prescription, do they give you just one pill and you're healed? They don't give you just one pill, right? You get a bottle of pills. You're taking this stuff every single day, sometimes multiple times a day for months probably, right? Guess what? Your doctor just gave you a treatment plan and you didn't even know it, or you didn't think of it that way. If you go to physical therapy, are you going to go in for one exercise session and everything is completely cured and you're back to normal? No, you're going to be going there 3 times a week for at least a month, if not longer than that. Well, guess what? You just were given a treatment plan. If you go and you decide you're going to change your diet because you want to eat healthier, lose some weight, or whatever the case may be that you're trying to accomplish with that, do you eat one healthy meal and then your body completely changes instantly? You're beautiful, you're in perfect shape, you've got muscles everywhere, right? Does that happen with just one good healthy meal? Or do you have to keep having a healthy diet for a longer period of time consistently in order to see any kind of physical change? Well, guess what? You just did a treatment plan with your diet, all right? How about exercising? If I go to a personal trainer and I say, you know what, I want to lose some weight, I want to get more fit, I want to be healthier, what am I going to have to do? Are they going to tell you, well, you just exercise one day, you're going to walk out of the gym, you're going to look completely different, you're going to lose 100 pounds and everything's going to be perfect? That's not what's going to happen, right? That's ridiculous. No, you're going to have to go 3 to 5 times a week to that gym, and you're going to have to do that for months before you're going to see any kind of change in your body. Well, guess what? You just did a treatment plan. You see, this is not abnormal or unique to chiropractic. The reason that treatment plans are given, or multiple treatments of whatever it is that you're doing are given, is because your body doesn't change fast. Your body tends to get comfortable. So for example, if I have these misalignments and I have problems with my back, guess what? It's been there for a while and it's comfortable there now. It's not going to get fixed overnight. We have to give it a series of treatments in order to get any type of long-term change to be accomplished with that, all right? And like I said, this is not different for chiropractic compared to anything else. No matter how you decide to treat a health problem, you're going to be dealing with it for quite a while, all right? So that's the bottom line. That's what we do. We have a lot of patients, because sometimes when people will watch this video, they'll think, well, you're just against medications, and I'm not. You know, here's the thing. Some people let the problem get so bad that you need a little extra help in order to get you over this area. But here's what my recommendation is. If you're going to do the medications to help you alleviate some of the symptoms, do that, but don't ignore the actual problem. Do something at the same time to make sure that you're correcting it, so that way when you get off the medications, you're not dealing with a more serious problem at that point. That's basically the whole point of this video, all right? Well, thank you so much for spending your time with me. I hope that you found that information helpful. If you have any questions, come to our website. Feel free to look around. And of course, call us if you need some help and you're in our area. All right? Thank you so much. Have a great day.